this question we've answered before, but we're talking about FEHB and Medicare. And with Medicare right now being in their AEP, annual enrollment period, and there's a lot of questions that's surfacing about Medicare. There's a lot of news, advertisements on the TV when it comes to Medicare and the different choices. I get asked a lot, how do your FEHB, your Federal Employee Health Benefits, and Medicare coordinate, and how do they work together? And the answer is simple. We've done it before on another episode, but I wanted to bring it up because the people that I've been talking to recently have had this question. So if you haven't seen a previous episode and you don't want to go diving back into it, I want to answer this question again. But FEHB, your Federal Employee Health Benefits, and Medicare do coordinate and work together, but they work together differently depending on whether you're actively employed or when you're retired. So when you're actively employed and you've hit age 65 when you become Medicare eligible, number one, when you hit age 65, you'll automatically be eligible for and covered under Medicare Part A. Now, you should enroll in that right away. There's no reason for you not to, because you've been paying into Medicare this entire time while you're working. And when you turn 65, you automatically get Part A. You should enroll in that right away. You will choose whether or not you're going to enroll in Part B of Medicare. And that's the additional optional side of Medicare that you'll have to continue to pay for going forward. Right now, it's about $185 a month for Part B. In 2026, it will go up. It will be over $200 a month for Part B. So that's a decision you have to make. Now, while you're working, you're not going to have to choose Part B of Medicare. That'll be more of a decision for when you retire if you have not chosen it while you're working. But how does it work while you're still employed? Your Federal Employee Health Benefits will be your primary while you're employed, and Medicare will be your secondary. Now, when you do retire, when you separate from service, it will flip-flop. Medicare will be your primary coverage and your FEHB will be your secondary and act as like a Medicare supplement type of plan. They coordinate together. It just depends on which one's primary and which one's secondary. And as I mentioned about Part B of Medicare, depending on what agency you work for, if you're a postal employee, in order to keep your health insurance in retirement, you will have to take Part B in retirement. It would be a requirement. Okay, military folks, ex-military, if you're on TRICARE for life, you have to take Part B of Medicare to get TRICARE for life. Other federal employees, you may not be required to take your Part B of Medicare, but it might be a good move for you. You just have to understand the costs involved and what Part B actually covers. So that's a conversation we can have specifically on your situation. If you need more assistance on that, go to our website. I should have mentioned it earlier, but I didn't. It's federalretirementshow.com. You can fill out the form. One of our experts, if it's not me personally, will be reaching out to you to answer any questions and go over your situation. But that's federalretirementshow.com. And we can get you more information if you have additional questions on how Medicare and your FEHB work together. Thank you for watching the Federal Retirement Show. If you like this clip, make sure you subscribe, get notified whenever we have new content. We look forward to seeing you each and every week on the Federal Retirement Show.